closing his mind and only believing that his opinion is correct. So what I don't like is a physician that doesn't listen well and doesn't take much time and doesn't show an understanding or caring attitude.
I don't like him to be arrogant and not paying attention for me.
Something you don't like is when they're not interpersonally, when they're not connected to you, when they're superficially just looking at things and then they just want to get rid of patients, you know. So it's more how much they feel about how much your need is, what your trouble is, how much they feel about you. That's important.
Right. Does it matter for you the appearance of the doctor?
It does, because if you come to see your doctor and you are sick, you don't want to see somebody who looks tired or who seems like doesn't have a time, who's answering his phones during your attendance. So it does, it definitely does.
Appearance of doctor, it's very important for me. Yes, it indicates what doctor is. Seeing him in thobe or doctor coat, it's normal for me. I prefer to be in doctor coat.
Yeah, it matters a lot for me, because how can I trust a doctor who is untidy? I will not trust him because he is going to treat my health, and if it's not clean, nice looking, I will not trust him.
Well, it should be good looking, as I said, and he should look like a doctor.
What do you prefer, to see him in a thobe or in a suit or in a lab coat?
No, lab coat is better. Lab coat is better.
Regarding their clothing, no, it doesn't matter at all. And it doesn't matter where they're from. Really what matters is more like the person that they are and the kind of doctor that they are.
Not particularly, as long as he or she comes across as being professional.
Yes, of course.
And what do you prefer to see him in a thobe, suit, or lab coat?
A suit and lab coat, both of them, because he looks more professional.
No, not really. I don't think appearance has anything to do with a good doctor or a bad doctor.
Okay. How much does it value to you, that doctor's qualifications and working experience?
It does. It's not that I'm looking for what school they did attend, but on the first visit you can already tell if the doctor is professional or not, how he communicates with you, and that's how I do choose my doctor.
What I'd like about doctor qualification and experience, it's very important for me, because it shows how much experience, how much cases he faced during his work. Because sometimes you will face some cases where you cannot evaluate by studying. You need to see some experience, some similar cases, and know how to do in this situation.
It really matters a lot for me, because I want a doctor who is always updated to the latest in field of medicine. He should be, he knows what is the modern and the latest in the techniques and its skill. He should be always attending the seminar, symposium, so that he will know the best treatment for me.
Well, it's worth too much for me, because if he is not specialized, he might be kill me, or get my issues worse than I am. It's very important.
The qualifications and experience of the doctor are extremely important, in my opinion. The qualifications, I would believe, are a given, that the doctor should have formal qualifications that are from a reputable institution. The experience is something else. So I would prefer to deal with a doctor who's experienced in his or her field.
Definitely. I mean, the work experience is the most essential thing. I mean, qualification obviously matters. Every doctor has to be educated, well educated. Experience matters a lot. How many patients he has seen. It's just like any other profession. I mean, how much you've worked in your profession, you understand more and better. Definitely experience matters.
Okay. Do you have any precautions if the doctor is a man?
Well, I prefer the female doctors. To be very honest, I'm more comfortable with female doctors. Yeah. It's probably not just issue here, but I'm more comfortable with female doctors. Yeah.
Okay.
For dealing with doctors, I don't have precautions for, if doctor is woman. I prefer to be a man, so I can explain clearly what's problem with me. I feel comfortable dealing with doctor as a man. But if there is no other doctor except woman, fine, no other choice.
No, it doesn't matter to me, and as long as he knows what he's doing.
No, it's okay. Both okay with me.
No, it doesn't matter at all to me if it's man or woman.
Not at all. I don't mind dealing with either a male or a female doctor. I have no strong preference either way.
Do you have any precautions if the doctor is a man?
No, it's okay with me.
Do you have any precautions if the doctor is a woman or not?
No. As long as I said, they are understanding, they are educated and experienced, of course there is no problem.
How about other doctors, like from your country or other nationality?
Well, at home I go to see the doctors which are very professional, because I choose them, because they listening my problems and they spend their time with me if I'm attending them as a patient.
Okay. Well, and does it make a difference for you if the doctor is Western or not?
No, not at all.
Why?
Because you will find some high qualifications here in the Middle East and with the Arab world. Well, yes, in the Western they have, but also they have bad doctors. But in Arab world also we have high qualifications, should be evaluated. So it doesn't matter for me.
And does it make a difference if the doctor is Western or Arab or from another nationality?
Because I saw a lot of Arabs right now that is updated. Some are better than the Western.
Yes. Because they are specialized, I guess.
So far in my experience here in Saudi Arabia, I've mainly dealt with Arab doctors, and I've found them to be just as skilled and qualified as Western doctors. So I don't feel the need to deal with one or the other.
It doesn't matter. But I like Arab because they understand me more. I think it's my opinion.
To be honest with you, I'm an Asian myself, so I prefer going to an Asian doctor, and I also believe they are more experienced as well. Living in this part of the world, especially, I mean, we know when a Pakistani or Indian doctor is coming down here, it brings a lot of experience with himself or herself. So we feel more comfortable going to an Asian doctor. Yes.
How do you generally evaluate a doctor's performance?
Well, one of my concern is when I'm in the doctor's office, if he is telling me exactly what he's gonna do, and I'm aware of everything what he's gonna do, why he is doing it. So it's a perfect explanation to me as a laik, because I don't understand what is going on. So complete explanation of the problem, of what is he doing. That's most important.
Evaluating doctor performance, first of all, by how he's dealing with a patient, then with the result after some time. I don't like the doctor that give strong medicine that you will see performance in very short time, because we know that in the future it will harm the body. But some doctors, they will give medium medicine that will see the evaluation and result after some time, which is accepted for me.
Upon how he deals with the patient, how he is concerned and how he treats. You can evaluate his skill upon how he expressed himself, how he did the treatment and everything. You will know what's the best. Just listening how he speak and how his performance is.
Well, the indications after I took his medicine, after I took his advice, the health indications, healing,